Morning, everyone. So today we're going to talk about a super important topic, kind of do a spin-off on the topic we spoke about last week, and why stretching and foam rolling is not always the answer. And so what we're going to kind of go talk about today is like self-treating in general. When should you be doing self-treatment, or when is it time to go see a specialist for the injury? So, because I see this a lot, where a patient comes in, I ask them, what have you tried? What have you not tried? And 9 times out of 10, they said that they've tried self-treatment, and I asked them, how long have you been self-treating this for? And I get ranging answers. Sometimes I get only a week, and sometimes I get years, and that's when it becomes a problem. People ask me all the time, like, when is it time to go see a specialist? So self-treatment's not wrong. It's just you don't want to be, if it's not working, the definition of insanity is doing the same thing over and over again and expecting a different result. So self-treatment, if you've like sustained like a minor injury that doesn't seem like it's too bad at the moment, and you can go about and self-treating that for a week or two and just see, maybe it'll calm down. You can try different exercises and whatnot to get it to calm down, based on what you're experiencing with those exercises and what feels good and what feels right. But if it starts going on for more than about 2 or 3 weeks, most likely there's something more serious going on, and most likely there needs to be a specialist that needs to look at that. So yeah, after that, usually that 2 or 3 week mark is when I encourage people to start looking into going to see a specialist. And so a lot of times people, I'm gonna go on tangent here, a lot of times people go to turn to YouTube. So if like somebody like a runner sustains a knee injury, and they're like, they go on YouTube, best exercises for knee pain with runners, and you're going to get a whole gamut of different types of videos on what exercises that YouTube creator of the video would say to do. The problem is with that is everybody's different. There's tons of different types of knee injuries, and no knee injury types of knee injuries, like we have like an ACL tear, we have like meniscus, we have patellar tracking issues, we've got a IT band syndrome, runner's knee. We got a whole different types of injuries. And the thing is, when you go search that on YouTube, YouTube doesn't know what injury it is. And on top of that, just because you have an injury doesn't mean that's there's different varieties of intensities of that injury too, right? It could be mild, moderate, severe. YouTube doesn't know that either. And so that's the problem with YouTube. So I kind of want to walk you guys through like the steps that you would have to go through and guess right on to figure out and help treat this issue. So first of all, you have to first find the true cause of what caused this injury. All right, that's first and foremost. So for example, if somebody's ergonomics or their setup at their desk is a problem and causing it, you can do all the exercise that you want, but it's going to be a real uphill battle because you're not addressing the root problem of it and figure out what's causing it in the first place. So that's first and foremost. You have to find out what the root cause of it is. All right. Then on top of it, you have to make modifications to your desk or to your running form, and you have to know what modifications are appropriate for that, based on your injury, based on your running mechanics, stuff like that. So you have to make modifications to that. Then on top of that, once you've done that, you have to find the right exercises. Okay, there's hundreds of different exercises out there, ranging from very, very simple to highly complex, and you could fall anywhere in that spectrum. Okay, and if you go in and do an exercise that's too intense or too high in that spectrum, it's actually going to make the injury worse. And that's where I see a lot of people go wrong in self-treatment, is they actually make the problem worse. One, because they're not even really truly finding the root cause of it, and they're doing exercises that aren't even gonna address the issue, and it's just irritating another area of the body, and now they've got two injuries, and the other current injury is just worse because they're not addressing the right area. Okay, because a lot of times with knee pain, rarely is the knee the problem. The knee is going to respond to what that foot and that hip tells it to do. Okay, because it falls right in between. Okay, The hip musculature supports that knee, the foot musculature and the position of that supports that knee. And so a lot of times if you just go on and do knee exercises, that's not the true issue with it too. So that's another problem with that. So yeah, you have to find the right exercises, and then on top of that, yeah, you have to find the right version of the exercise. Okay, you might have found the right exercise, but there's different tweaks that you can do to make it easier or to make it harder with each exercise, and you have to find which one is best for you, and that can be very difficult. Then on top of that, you have to do, even if you've narrowed it down where you've got the right exercise, you've got the right modification, then on top of it, you have to do the exercise correctly. All right. And that's where a lot of people go wrong too, is they're not doing the exercise correctly. Okay. If you get all those steps down, then you on top of it, you have to find the right dosage. Just like if you go see a physician and they give you medications, they have to get the right dosage right. Same thing with exercise. What I mean by the dosage is how many reps, how many sets, how often you should be doing it, what's the rest period that you should be doing. Okay, that's the dosage. And how many times, yeah, throughout the week or throughout the day should you be doing the exercises. Then on top of it, you have to find the right combination of the exercise. There's not one exercise, one single exercise that's going to fix an issue. It's got to be a variety of different things, and you have to find that variety of exercises on top of that. Okay, so then you also have to have consistency, and this is where I see a lot of people go wrong too. Is they may have found the right, they might have found the right exercise, they might have found the right dosage, they might have found the right versions of the exercises and the combination. However, they didn't keep the consistency up. So I've had patients come in the past, and I'm taking through exercises, and they're like, "Oh, I've already done this one before," and so I have to be really careful with this when they tell me that they've done these exercises before, because they may have done the exercise, but what was their dosage? What was their reps? What was their sets? How long did they keep up with it? Or were they consistent? And most of the time, people weren't consistent with it. They did it for like 2 or 3 days, and then they just threw it out the window because they didn't feel like it was working. It takes a little bit of time. It can take 5 to 7 days to really start seeing improvement with exercises. So consistency is huge. And so and don't the big thing is, don't just throw out an exercise because because it's not working within 2 or 3 days. Okay, you have to have consistency with it. And then on top of it, if you get all those things correct and you've got the consistency down, then if you start feeling better, you have to be able to ramp back into things appropriately as well. How much rest should you be doing? Should you be, like, for example, if you're having knee pain with like squatting, should you be resting completely, or should you be working out in the gym and doing a variety of different exercises that aren't going to aggravate the knee? The answer is the latter. So you want to be exercising as much as possible and just not doing exercises that are going to aggravate the knee. Okay, most times people just take tons of rest and then just do like rehab exercises, and that's typical with a lot of traditional PT. That's not the answer, because a lot of other areas are going to get weak from not working out, and that's going to pose other issues and whatnot too. So you have to be able to know how much rest is appropriate during the rehab process, and while you're doing these exercises and working on getting back to full strength too. And then on top of that, when you do start feeling better and you've got a good routine going on, you have to figure out how to ramp. Like, for example, you have to figure out, for runners, you have to figure out how to ramp up appropriately. Should I jump right in and do 2 miles? Should I jump in? Should I be doing like a minute off of running, 1 minute on, 1 minute off, 1 minute on, 1 minute off for 5 minutes? You have to figure out what is appropriate for you with regards to ramping back into the activity that you want to get back to. Okay. And then on top of it, after you get all those, you have to figure out what's going to prevent this from coming back in the future. And usually it's a routine, a strength training routine that you have to do like 2 or 3 times a week to help kind of maintain the changes that you might have created through the exercise rehab routine. Because I get these questions a lot from my patients, like, do I have to do these exercises the rest of my life? Usually it's like the question like right in the first like 2 or 3 sessions. And I'm like, well, it depends. Are you just going to do stretching? Are you just going to do foam rolling? If that's the case, then yeah, you're going to have to do these exercises the rest of your life, because stretching and foam rolling is not treating the root issue. It's kind of just a band-aid. And we got to figure out why is that, like, for example, if you're like quads tightens causing a lot of knee pain, if you're just going to do stretching and foam rolling, that quad tightness is just going to keep coming back, and you're going to have to keep treating it with foam rolling and stretching. First of all, you got to figure out why is that quad getting so darn tight in the first place. Okay, and that's really what's going to treat the root issue with it too. Okay, so no, you do not do the exercise the rest of your life if you treated the root issue. But yeah, if you're treating it with stretching and foam rolling, yeah, most likely you're gonna have to keep up with those exercises for a long period of time with that as well. So one other important thing that I want to reiterate is I get a lot of questions like, oh, it must be nice to be a physical therapist. If you have an injury, you can just treat yourself. I don't even treat myself. I had a professor in school that put it perfectly. A doctor or a physical therapist or a physician or a chiropractor who treats himself has a fool for a patient. What he means by that is you shouldn't be treating yourself. Okay. For example, if I have an injury, I have Dr. Colin or Dr. Nima take a look at my injury and come up with a plan for me because I have my own biases and I'm not going to be effective with it. For example, I think right now we have approximately throughout the practice, we have about 80 patients. Oh, we see about 80 patients a week right now. We have out of those 80, I think we have 3 physicians that are currently seeing us. One that's a sports med physician, one that's general practice, and then one I think that's what's the other one? Can't remember what the other one specialty is. And we're also seeing another physical therapist from another clinic as well. And so that goes to show you that if doctors and physical therapists, chiropractors, physicians aren't treating themselves, I'm gonna put it blatantly, you probably shouldn't be treating yourself either. Okay. It's super, super important to get another pair of eyes on the issue and fix it and have them help you, guide you along the way. Because most likely you are going to miss everything. So those, you guys saw how many different steps there were, right? So I want to reiterate, like everything that you have to get correct to really fix an injury. All right. So just recap, you have to find the true cause. You have to make modifications to what caused it in the first place. You have to find the right exercises. Then you have to, once you find the right exercise, you have to find the right version of the exercises, do the exercises correctly with the correct form, find the right dosage. Okay, how many reps, how many sets should I be doing? Then you have to have consistency, the correct amount of rest during the rehab process, ramping up appropriately once you start feeling better, so you don't cause this whole cascade of issues again, and then the right routine or strength training program that's going to make sure that you're essentially bulletproof and this isn't going to happen again a few months down the road. So that's a lot of different steps that people don't realize that they have to get right. So I hope the big thing is I hope you guys realize that if it's a significant injury, the likelihood of you being able to go on YouTube and just searching like what are the best exercises for knee pain or best exercise for hip pain or best exercise for low back pain and fixing the true issue, it's extremely, extremely low. And I see so many people go years with this whole process, and it's pretty sad because I have so many patients come in and after the first 1 or 2 sessions they're like, oh my gosh, I feel so much better. Like this was so simple. If I would have just came in, I could have bypassed the whole last months or years that I did of self-treatment, and I could have gone about my life not having to deal with this injury, right? So that's kind of my spiel on self-treatment. Again, I'm not completely against it. Like if it's the first week or 2 after an injury, give it a try. A lot of times it may just clear up on its own as well. So give it a week or 2. You can do different exercises. Just make sure that there's none of the exercise should be painful or anything like that too. So give it a week or 2, maybe 3. But if after 3 weeks it's not making changes or getting better, or actually maybe even getting worse, then you definitely need to see somebody, whether it's us, another physical therapist, chiropractor, physician. Go see somebody, okay? And I encourage you guys to make sure that when you reach out to somebody, that they have a track record of helping other people like you get where you want to go and have the active life that you want to have too. Okay. So that's my spiel on self-treatment. Hopefully you guys found this beneficial. But yeah, if you guys have any questions about this, please let me know. All right. Thanks, guys.